Now, maybe this is the time that we can show some of the spinal situations, then our viewers can get a better idea about it. Now, we have here on camera, I hope it's visible, so maybe you can start explaining to us what it is really.
Okay, well, if somebody comes to me with a herniated or a bulging disc, they could have symptoms down, depending on which nerve root is affected, whether it's the first nerve root, the third nerve root, or the fifth. They have different distributions, so sometimes patients have pain on the outside of their leg, sometimes they have it on the inside of the leg, sometimes it's all the way down into their ankle or heel. So usually what that means is that there's pressure being pushed on the disc, and kind of like a jelly donut, the disc is escaping its center and putting pressure on these very delicate nerves. What spinal decompression does is it increases the height and allows blood, oxygen, and other vital nutrients to flow into the disc and allows the disc to start healing once again. This is a small picture of what it looks like. It's a much bigger machine behind it, but this shows what it's like. It's a very comfortable, painless procedure. Mm-hmm. And we go back to this. This is what a normal disc should look like, and that's what a bulging disc looks like. This little hole here is where these nerves escape through. So if it's a nice and happy normal disc, there's no pressure, but if it's starting to bulge, or worse yet, even herniate, that nerve gets pressure, and nerves don't like pressure. So once we remove pressure, the body will heal itself naturally. And it's going to take time and some hard work, but it does work.
Now, is this something that once one has done it, it's done, or is it something that has to be updated so now and then?
I haven't. Once I've completed with a patient, they're done with the spinal decompression protocol. They sometimes need follow-up chiropractic care, whether it's once a month for maintenance or updating their exercise protocol. So the treatment is usually just done once. In very rare cases, if someone is really, really bad, they may need 7 or 8 more visits. But most people are done at 20.
Now, once the spine has been decompressed, can it get compressed again?
Absolutely. Right. What I always like to tell patients is that nothing makes you bulletproof. Healing is kind of like you're constantly working at it. Kind of like when you brush or floss your teeth, you need to maintain it. So health is you're constantly working at it. So once you're decompressed, if you don't injure yourself again, you're okay. But if you injure yourself again, you got to take care of it.
Right. But without the injury, it can occur also. I'm thinking more of the elder people that maybe have a degeneration of the bones and things.
Right. That's why we encourage them to follow an exercise protocol that keeps their spinal muscles strong and keeps their core engaged, so they have a sense of where their body is and they know how to bend and how to lift to not re-injure it. So we also offer a back school. So when patients are done, we teach them how to bend, how to walk, how to shovel snow, simple things that really prevent them from re-injuring themselves.
Now, what is one of the key things that somebody should actually watch out for in order not to injure their spine or not to have the spine degenerate?
Exercise, keeping your body fit, your core muscles engaged, and just being careful of the way you bend, lift, and twist. Sitting is also really bad for the spine, so if you're sedentary and sitting for 8-10 hours a day and you're not eating right and you're not stretching, you're prone to having a back injury, and that can be pretty devastating.
What percentage of the population would you say has a back problem?
I mean, I don't have the numbers in front of me, but it's a huge population. I don't have the numbers in front of me, but I'm sure it's at least 60% of the population has some kind of back problem sometime in their life.
Do you find it to be prevalent only from here, or would you say that's a worldwide problem?
Oh, it's a worldwide problem. I have people I consult in India, Venezuela, everywhere. I mean, depending on how much people work on their body. Most of us are sedentary. We're sitting, so that puts a tremendous amount of pressure on our back. But there's other countries where they're bending all day, pulling weeds out of the ground, or on their hands and knees, and that's also pretty, bad for the back. So it's a worldwide problem.
What about the people that are hunching? There are many countries, like in Asia and so on, they're sitting in a hunched position. Would that affect the back?
Absolutely. Your spine kind of adapts to the posture that you're in all day. So if you're hunched all day, with time, 10, 15 years, you'll have this hunched appearance. That's why I always have patients that are, sitting all day to do exercises opposite of the habits they're in all day. So like things like yoga, Pilates, gyrotonics, swimming is one of my favorite exercises. Engaging the muscles in the opposite position that they're in all the day, all the time.
How about yoga?
I like yoga. I think it's great. What I think that people get into problems is when they advance too quickly in yoga and they walk up.
Force themselves.
They force themselves, and that's how I see injuries. If you're doing yoga, you got to take it one step at a time, and have individual, attention as opposed to in a huge class and being pushed. Because I've seen too many people in a class, and next thing you know, the teacher's not looking at them, and they're injured, and they want to.
Or that the teacher is forcing them into a position also sometimes,
and
then you get an injury.
Then we see them.
Right. What about children? Do they run a risk of this also?
Not so much the herniated disc. Very rare, but children definitely have a spine, and they definitely have issues with their spine. And a lot of chiropractors treat children from birth on up. So pediatric chiropractic is gaining more and more awareness.
Well, especially with the various sports that they do and so on, they can easily injure themselves.
And kids usually they don't know how to tell you that their back hurts, and sometimes you could see it in the way they walk or the way they stand. And posture is really important to look at. So if your child is injured in a soccer game and he starts walking funny, definitely have a chiropractor address that.
Now, you mentioned some of the things and major things that can be affected by the spine being compressed and so on. You mentioned, for instance, that people will notice a problem with their legs and things like numbness in the legs and so on. But can it not affect any part of the body? Like, for instance, eyesight and things like that also, if the spine goes out?
Well, I mean, that's the autonomic nervous system. As chiropractors, there's two portions that we work with. We work with the nervous system that controls sensory and motor, so making your fingers move, or the nerves that go to organs that don't have any sense, like your lungs or your kidneys or your heart. So chiropractic's been around for over 100 years, and it's based on the fact that when you remove interference in the nervous system, the body works better. So, absolutely, depending on what it is. We don't treat people for those individual conditions.
They are benefits that they can get out of it.
Absolutely. I mean, before I was a chiropractor, I had tremendous stomach problems, and the chiropractic helped me get rid of my irritable bowel syndrome. That's why I'm a chiropractor today. It had nothing to do with my back.
Okay. Well, we have to take a short break for our sponsor. We'll be right back.
Okay.